Students, hello. Okay, now today's topic is the we have to discuss the liver as a whole, in which we have to revise all the blood supply and venous drainage of the liver, as well as the hepatobiliary system, regarding the formation of the bile and its drainage and storage in the gallbladder, the microscopic structure of the liver, a gross anatomical structure, as well as the microscopic structure of the liver. So I think so कि हम इसकी arrangement थोड़ी सी change कर लेते हैं. First of all, we are discussing the gross anatomy, then histology, then ductal system, and after that we discuss the blood supply and the venous drainage. Okay, these are our learning objectives, as well as we can say that learning outcomes. So at the end of the lecture, each and every student just take their own exam by asking that either these all objectives are fulfilled or not. Either he or she can able to give the answer. For example, here it is written as that identify the lobes in the surfaces of the liver. This you can make a question, may I identify, I can explain all the lobes, the name of the lobes, the surfaces of the liver, as well as the segments of the liver, then histological structure of the liver. So the main important thing of this lecture is histology, because you are from the third year, and the base gross anatomy is okay, it's important, but not as much as histology. So you should know about the histology, and also you should know about the basic biliary system and how it is started at the level of the bile canaliculi, canal of herrings, and then they are gathered and forming a large duct, then largest duct, and how they are going to the cystic or the gallbladder. Okay, so we are just doing all the plan, or you can say the whole classification, how it is all. Okay, now we will discuss in details after that the veins and the arteries, but now here we are still discussing the macroscopic. Macroscopic means that the gross anatomical features. Gross anatomical means that by the naked eye, if you have a liver in your hand, what you can see. Here you can see this is our body, and we are dividing it into the 9 regions by means of the 2 vertical lines and the 2 horizontal lines. Okay. The horizontal upper line is known as the transpyloric plane. Why it is known as the transpyloric plane? There's a pylorus, it is at the level of the pylorus, or you can say the pyloric part of the stomach. Then this one is the interspinous plane or the intertubercular plane. Why? Because it just connecting the iliac tubercles. Okay, we are feeling the iliac tubercles and then drawing this line. Okay. Secondly, there are the 2 vertical lines, right and the left side, and this is this you can see the mid clavicular line. Okay, this is the clavicle, and we are just supposing the mid part of it, and then we are just making the mid clavicular line. So here, this is the mid clavicular line, and one on a little bit medially here you can see this is a semilunar line, or we can palpate the rectus sheet, and this is basically the this is the lateral margin of the rectus. Okay, now here we are dividing the whole into the 9 quadrants, and when we are discussing any organ location, we can just say that this is the liver, and it is placed in this quadrant. This quadrant is known as the right hypochondrium, or right hypochondric region. In the center, this is the epigastric region, this is the left hypochondric region, and you can say this liver is situated in it is the largest gland situated into this right hypochondrium, epigastrium, and the left hypochondrium. Okay, it is its location. You can see over here also. Why it is known as hypochondrium? Because this is the chondra means that ribs, and it is just below it, so it is known as a hypochondric region. Okay, epigastric region is the central region, just above the stomach, so it is known as epigastric. This is the right side, this is the left side. Okay. Now the weight is about you can remember that about 1.5 kg. Okay, but in the male it is a little bit more larger as compared to the female, and it is much largest one in the fetus. Why? Because the function in the fetus is hemopoietic region, hemopoietic function. It is just forming the blood cells. So the liver in the fetus are the largest one, and then at the time of the birth, it is just stop its growth, and otherwise the whole body is growing, and the liver is remain its own size. Lobes, there are the two lobes you can see over here, the right lobe as well as the left lobe of the liver. This is the anterior surface, this is the posterior surface. And the right lobe of the liver is about the 5/6 of the liver, while the left lobe is the 1/6, okay? In the center, this is the ligament, which is known as the falciform ligament. And why this is from where it comes? It is basically the peritoneal fold. Okay, it is basically peritoneal covering. Okay, and here on the posterior side, you can see there are the two ligaments are all present. One is known as the ligamentum venosum and then ligamentum teres. In the center, you can see this is the porta. Porta means the opening where the arteries are entering, and the portal vein is also entering, and then the cystic duct, or you can say the bile duct, is coming out. And from the right side, the right hepatic duct, from the left side, the left hepatic duct, and then this one becomes the common hepatic duct, which comes out from the porta hepatis. So here you can see the three structures is visible: the portal vein, the hepatic artery, and then this one is the bile duct, and this is the forming the triad. Also, we will discuss in shortly in the microscopic structure. Okay. Okay, in the right lobe of the liver, as it is the largest one, here you can see it also containing the two more lobes, which are known as the caudate lobe and the quadrate lobes. Okay, we will discuss the boundaries of these lobes. This upper one is the caudate one, and the lower one is the quadrate one. Here you can see also, only here this is the left side, and this is the ligamentum teres. And the upper part of it is the porta hepatis. The margin, and here you can see the inferior margin or inferior border of the liver. On the right side, this is the fossa for the gallbladder. So this is the margin for the fossa for the gallbladder. So all four margins, they are forming the quadrate lobe. And here you can see the caudate lobe. Here in the upper part, this is the upper margin, and then here this is the ligamentum venosum, which is the remnant of the ductus venosus. On the right side, this is the groove for the inferior vena cava, and here you can see the papillary process is present, which is known as a papilla-like or tongue-like projection, which is known as the papillary process. Okay. Here, one thing you can see, this is the margins of the ligament, and here it is not this area is not covered by the peritoneum. The area which is not covered by the peritoneum are known as the bare areas. Okay. Regarding this left lobe, you can see this one is the left lobe, and it is a 1/6 portion. It is also, you can say, here this is the ligamentum venosum. Near to the ligamentum venosum, it is the bulging or elevation, and this bulging is known as the tuber omentales. Now, the caudate lobe and the quadrate lobe present on the posterior side. This one, upper one, is the caudate, and inferior one is the quadrate one. And the porta hepatis, this is the porta hepatis. Porta means opening in the liver, just like the hilum in the lung. Okay, the structures are entering or exiting through this hilum or through this porta or through this opening. So it is just like a gate you can see. Okay, this is the porta hepatis, and you can see here the three structure. One is blue in color. It means that it's a vein known as portal vein. The one is the artery, and this is the hepatic artery. And then one is green in color, which is the common bile duct. And this common bile duct is taking the bile from the right lobe of the liver as well as the left lobe of the liver. Bare areas of the liver means that all the areas of the liver which is not covered by the peritoneum is known as the bare areas. And here you can see the bare area this is the large bare area, you can say on the superior surface. And on the posterior surface of the right lobe, limited above and below by the two layers of the coronary ligament. This is the ligaments, and you can see this is a reflection of the peritoneum, and these are known as the coronary ligament. So this is the two layers of the coronary ligament. So in between the two is this area is the bare areas. Okay. Otherwise, you can see just below this gallbladder, or this is a fossa for the gallbladder. In this fossa, the gallbladder are lodges. So this area is also devoid of the peritoneum. So it is also bare area. And this is a groove for the inferior vena cava. Here you can see just below this inferior vena cava, it is also not covered with the peritoneum, and this is known as the bare area of the liver, one more. And in the porta hepatis, you can see the margins on its boundary wall, but there is not covering. So it is the opening, it is the gate. So here it is also devoid of the peritoneum, and it is also bare area. And along the reflection, here you can see this is the reflection of the peritoneum, when the peritoneum is going from the abdominal wall and then going up, covering the liver, and then they are just reflected towards the diaphragm. And so this reflection area is the bare areas. Okay, now we can see just about a little bit review of the ligaments. How the ligaments are formed? Ligaments are formed by the peritoneal foldings. Okay, so number one, the biggest one is the falciform ligament. Here you can see this is the falciform ligament. It comes from the abdominal wall going up, and then here you can see this is the undersurface of the diaphragm. So this is a sickle shaped fold of the peritoneum which ascends from the umbilicus of the umbilicus to the liver and connect the anterior and the superior surface of the liver to the anti-abdominal wall and to the undersurface of the diaphragm. This is the undersurface of the diaphragm. So this is the falciform ligament, and its free margin contain ligament. Here this is the free margin. They contains the ligamentum teres, and which is a remnant of the umbilical vein, and then the falciform, and also the one more on the back side. This is a ligamentum venosum, which is a remnant of the ductus venosus. At its upper and the two layer of the falciform ligament are separated. Here you can see the right part of the, or you can say the right branch of the falciform ligament. This one's the left one. So it is just the falciform ligament is splitting into the right and the left part. So it is just forming the two layers. The left layer is continuous with the anterior layer of the left triangular ligament, and the right layer is continuous with the coronary ligament. What is the coronary ligament? Here you can see this is the coronary ligament on the this is the two parts. This is the bare area without it. And this the bare area is bounded by this coronary ligament, the two limbs of the coronary ligament. Okay, so you can say this is a reflection of the peritoneum from the diaphragm to the superior and the posterior surface of the right lobe of the liver. It consists of an upper and the lower layer, which are continuous at its extremity, where it is forming a triangular structure. Here you can see this one is the coronary ligament at this level, and now this one is beak-like structure, a triangular structure. This is the triangular ligament, as it is present on the right lobe of the liver, so it is known as a right triangular ligament of the, but diverging to the left, as in encloses posteriorly a large triangular area on the right lobe of the liver, and this is the bare area. This is the bare area. Here the coronary, the falciform ligament. Anteriorly, you can see this is the falciform ligament. It is just splitting into two layers, the right layer and the left layer. Then you can see that on the posterior side, here this on the right side, they are forming the coronary ligament. This is the coronary ligament, and this coronary ligament, they are containing this bare area, and at the extremity, this coronary ligament, they are forming a triangular ligament. Okay, so this is the bare area, this is the triangular ligament in this diagram, this one. Okay, now the lower layer is continuous with the posterior layer of the right triangular ligament and goes to the posterior surface of the right lobe, and left triangular ligament connects the superior surface of the left lobe of the liver to the diaphragms. Okay, the right triangular ligament connect the lateral part of the posterior surface of the right lobe of the liver to the diaphragm. Lesser omentum, there comes from, they are connecting the porta hepatis to the lesser curvature of the stomach. So this is the liver grossly, this is the superior surface, this is the right surface, this is the inferior surface, this is the anterior surface, and the posterior ones. Okay, so we are just dividing this all. The superior surface is the whole surface, which is the under the cover of the diaphragm. You can see in the center, you can see a little bit impression or depression, you can see, and this is the cardiac impressions. Okay, okay, and then you can see it is in contact with the diaphragm, and this diaphragm separated on the right side from the pleura. Here you can see in the upper 1/3 the pleura one, then the middle one here. This is no pleura, but only the rib cage is present, and inferiorly here you can see there is no pleura and the diaphragms. Okay, so it is in contact with the diaphragm, is separated on the right side from the pleura and the 6 to 10th ribs with their costal cartilages, and on the left side 7 to 8 cartilages. The median part of the anterior surface of the liver lies behind the, here this is the median part in the central part, and it is just behind the xiphoid process of the sternum. Okay, here you can see the right side, the upper 1/3 is related to the diaphragm and the pleura, the middle 1/3, the diaphragm and the costal diaphragmatic recess, and the lower 1/3 is only the diaphragm is present without any pleura. Okay, and then the posterior surface, here you can see the posterior surface. It is much more important because the liver is just lying on the abdominal structures or abdominal organs. So here you can see this is the different impressions of the different organs. Okay, you can see this is the all grooves like or depressions are present, and all are there. We can discuss it के the hepatic impression, the kidney के जो होंगे वो आपका renal impressions होंगे, so we will see it. At the opposite surface, this is wide and convex on the right but narrow on the left. Its middle part shows a deep concavity for the vertebral columns. Okay, so vertebral column is also passing just behind it, so it has a little bit concavity in the middle part. Okay, students, I think so. Okay, no, we are not. You can go through all these because this is all the your review class, and you should know till this level. This is the anterior surface. This one is the posterior one, and posterior one has the depressions for the different you can say okay, structures, because this is here, for example, okay, the gastric or colic is present, or colon is present, so colic impression is present over here. The renal impression is present over here, and you can say okay, here these are the two lobes is visible, the quadrate lobe, the caudate lobe. So here, or you can visit the porta hepatis is also visible in the center, from where the entry and exit of the large vessels and ducts. Okay, and you should know that the structure present on the right side and the left side. The left side, the esophagus is present, so the left lobe is marked by the esophageal impression, while on the right side you can see the right colic flexure is present, or here the other you can see जो आपके structures होंगे, तो it is also visible कि आपका जो है renal impressions or the colic impression or splenic flexure is present over here. So this is not much more important at your levels, but you should know that the liver is lying on the abdominal organs or viscera. So on the inferior surface of it has the different impressions, while the anterior surface is a smooth one without any impressions. Okay. This is the inferior surface or the visceral surface, and here you can find the gastric impressions, the omental tuberosity is present on the left lobe, fissure for the ligamentum teres here between the right lobe and the left lobes. So the segment of the liver, here you can see we can divide the liver into different segments. Segments are important. Why segments are important? Because during the surgery, if you can suppose that if there is any carcinoma or tumor is present in any specific lobe or segment of the liver, we can resect it, we can separate it, and we can cut it down and remove it from the body without giving any harm to the whole liver or the structure of the body. Okay? So these are all the segments which can be removable without giving any, you can say, harm to the other segments. Why? Because each and every segment has its own blood supply, its own venous drainage, its own ductal supply. Okay. So this is known as the functional lobes of the liver. Okay. How we divide it? This is the line, you can say, on the basis of the blood supply and the brain and the biliary drainage, the liver is divided into right and the left functional lobes by a plane passing on the anterior superior surface along the line joining the cystic notch to the groove for the inferior vena cava. Superiorly, here you can see this is the inferior vena cava, and then this one is the cystic notch. So we are just drawing an imaginary line between the two and divide the right lobe and the left lobe. On the inferior surface, the plane passes through the fossa for the gallbladder. Here, this is the fossa for the gallbladder, and then we are passing one more line from the fossa for the gallbladder. and then it is from the middle of the caudate lobe. This one is the caudate lobe, so it is the middle of the caudate lobe. So we are just making the another line, middle of it, not the completely. Okay. Right lobe divide into the right anterior and the right posterior. This one is the right side, so we are just dividing it into the anterior and the posterior one. Left lobe divided into the left anterior and the left posterior. This one is the left anterior and then the left posterior. Why? This is the margin, basically anterior posterior. We can just draw an imaginary line, which is the you can say horizontal, and you can say it is also in the coronary planes. Okay, and then we are dividing the anterior. Then further we are dividing the superior and inferior by our convenience, for our convenience. So this is the anterior superior area, the anterior inferior area, so the posterior superior and the posterior inferior. Then this one is the medial and medial superior and the medial, and here this is one is the lateral superior and the lateral inferior. So we are just making different segments. First of all, divided into right lobe and the left lobe, and then right lobe is divided into the anterior and the posterior one, and then this anterior and posterior is further divided into the superior and the inferior ones. And here in the left lobe, you can see this one is the lateral segments. Okay. Okay, liver receives has a dual blood supply. Just like हमने कहा था ना, lungs में they are also receiving the blood from the two different sources. One is from the bronchial arteries, one is from the pulmonary artery, and because of it, regarding to their functions. So here in the liver, they also get the dual blood supply. And how it is? One is coming from the hepatic artery. Now see, this is the red in color. Hepatic artery brings the blood from the heart. Hepatic artery is a branch of the celiac artery, or you can say it is coming from the aorta directly. And so the celiac artery gives the branch hepatic artery. So it is a fresh blood, full of oxygen, and they are giving nutrition like that, oxygen and nutrition for the survival of the hepatocytes. Hepatocytes are the cells of the liver. So this is for the nourishment of the liver cells. While the second one is the portal vein. Here you can see the blue in color. It brings blood from the bowel. So whatever we are eating and absorbing into the villi of the small intestine, and now through the superior mesenteric vein and the splenic vein, they are forming the portal vein, and this portal vein carrying the blood, which is deoxygenated, but it is full of the nutrients. Why? Because whatever we are eating, either the carbohydrate, the amino acids, the fatty acid, they are all present in this portal vein. So this portal vein is taking the highly nutritious blood, but it is not containing oxygen. Why it comes here? For the metabolism, because we know that the liver is the metabolic factory, or here the metabolism occur. So all the nutrients are coming over here, and metabolism occur in the liver, and they are forming the different ATPs, which are utilizing for the different body functions. So 80% of the blood is coming through this portal vein for the metabolism, while the 20% coming from the hepatic artery, and it is just for giving the nutritions or oxygen to the liver cells. Okay. Here you can see the main vessels. They are just giving branches, and the branches are further dividing into the different sub branches, and then they are going into the segmental vessels, which are supplying each different segments. So within the liver, they divide to form the segmental vessels and further divide to form the interlobular branches, and then open in hepatic sinusoids. So we will see in the histology also how this blood flow is, the liver is richly supplied with the blood. Okay, the veins of the liver, here you can see all the blood either coming from the hepatic artery or it comes from the hepatic portal vein. They are just pooling the blood into the sinusoidal spaces, and then they are recollecting through the vein, and this is known as the hepatic vein, and they are just draining directly into the inferior vena cava. So without any consideration that either the blood is coming from the hepatic artery, it also drains into the hepatic vein, and either the blood comes from the portal vein, it is also drained through the hepatic vein and into the inferior vena cava, and then from the inferior vena cava, it just returned back to the heart. So The word is the sinusoid. Okay, we just discussed it in the histology. So sinusoids vein into the interlobular veins, which form basically sinusoids are the spaces. Okay, where the both bloods either coming from the hepatic artery or the portal vein, they are just pulling blood into the spaces, and these spaces are known as the sinusoids. Okay. So these sinusoids, they drain into the interlobular veins, which join to form the sublobular vein, and these sublobular veins join together to form the hepatic vein, and which open into the inferior vena cava. Portal vein also breaks up into the sinusoid. Hepatic veins are arranged into the upper and the lower groups. Lymphatic drainage. Okay, there are the two groups. One is the superficial lymphatics, the other one is the deep one. Superficial lymphatics run on the surface below the peritoneum and terminate into the caval, hepatic, pericardial, and celiac nerve. Some lymph vessels from the coronary ligament directly join the thoracic duct. Deep lymphatics and partly in nodes around the inferior vena cava and in hepatic nodes. Now come to the histology. Histology is very interesting and it needs your concentrations. Okay. This is the gross anatomy which we have discussed. Here lobes, and right lobe, left lobes, and here you can see this is one is the gallbladder, this is the cystic duct, all. But now you can see the whole liver is covered by the capsule, and this is known as the glycan capsule. Okay, and they are the septa. From these capsules, they just going inside and then divide the liver parenchyma into the lobes and the lobules. Okay. This is the basic picture, and I think showcase को थोड़ा सा elaborate करते हैं, थोड़ा सा large करते हैं. The liver is composed of the hepatocytes. This is the central vein. Okay, central vein means that in the center है vein है, so it is known as this one is the hepatocytes. Okay, so you can see this is the cells which are just making a row. This is line बनाते हैं ना, rows में line है and radially arranged है, okay, from the central vein. Central vein is present in the center and they are radially arranged, and these are all the rows of one cell thick, and you can say okay, this is known as the hepatocyte. But you can see okay, in between the layers of the hepatocyte, the white color jo na, this is the spaces. Okay, this is the spaces in between the hepatocytes, and this is spaces which is here you can see the empty spaces, and this is known as the sinusoids. So in between the hepatocyte, this is spaces known as the sinusoids. This is the spaces where the blood is pooling. Okay, and which is you can say okay, this is sinusoids are lined by the hepatocyte on the both sides. So hepatocytes are taking its nutrients for the metabolism inside the cells. Okay, now it's a very beautiful picture. You can see this is the central vein. This is the rows of the hepatocytes radially arranged throughout this. And here you can see hexagonal cell structure, and this is known as a classical lobule, classical hepatic lobule. Okay, and it is basically you can see this is the hexagonal. अगर आप देखें ना 1, 2, 3, 4, 5, 6, approximately 6 sides. Okay, so here in the center, this is the central, and this one is the you can say portal triads are present on its periphery. Okay, ये आपका triangular cell structure है on each corner of it. Okay, in the you can say in between the hepatocyte, this is the hepatocyte, this one is the hepatocyte. In between the hepatocyte, you can see that there is a spaces, and this spaces are known as the sinusoids. Okay, according to the classical concept of the liver structure, liver consists of innumerable hepatic lobules, roughly like polyhedral prism, measuring about 1 millimeter in width and 2 millimeter in length, and tributary of the hepatic vein lies in the center called the central vein. So here, this is the mean. What is the central vein? It is a tributary of the hepatic vein. The central vein of the different lobes and lobules, they are joining together to form the hepatic vein, and ultimately they are ending into the inferior vena cava. Okay. Here you can see what it shows. It shows the blood supply. Blood is either coming from this blue line, the portal vein, either is coming from the red. This is the hepatic artery. Okay, here you can see again. Okay, ये हम इसको बाद में बताते हैं क्या है. ठीक है ना, ये वन बाय वन आपको बताएंगे, ठीक है, वन अगेंस्ट. One is the classical lobules, okay. This one is the classical hexagonal in appearance. Okay? Here you can, this is the hexagonal. Okay, the blood is coming from the periphery toward the center. Okay, either from the portal vein, either from the hepatic artery, and they're all. Then second one is the portal lobule. Portal lobule is the triangular one. Okay, here their central veins are present, so we are connecting all three, and they are forming the triangular structure, and they are forming the portal triad. And then third one is the lower acinus. Here you can show that they are showing the ductal system, how the bile is coming from the different hepatocytes and draining into the bile duct. So we are just joining the two central veins, and then this is the drainage of the blood, okay, from the arteries and the portal vein toward the vein, central veins, okay. Then this is the second one is the portal lobules. This is also coming from the vein and then draining into the center, from the periphery toward the center, okay. And then third one is the lower acinus, and they are showing you the formation of the bile and then entering into the bile ducts. Okay, here you can see they are the central vein, or you can say tributary of the hepatic vein or venule. You can see three structures are present on the periphery. Okay, ये हम जिसे हम कहते हैं ना portal triad. Triad means three. Okay, one is the portal vein. They pull its blood into the sinusoids, and the जैसे हमने भी last diagram में देखा, the direction of the blood flow is from the portal vein toward the central vein. Okay. Then second is the hepatic artery. It is also pulling its blood into the sinusoid, and then the two bloods are mixing, either coming from the portal vein or from the hepatic artery, and they are just going toward the center, from periphery toward the center. Okay. Then the third one is the bile duct. Here you can see it is not pulling the blood. This is all the hepatocyte. They are forming and producing their biles. And this bile is through the ductal system, we are draining inside it, okay? So we are discussing the small bile ducts, and then they are all coming from this hepatocytes and draining into the bile, okay? Okay, portal lobule. This is the portal lobule, okay? Showing the portal system. Portal system means the portal vein is present over here, and they are just pouring blood into the sinusoid, and which are ultimately draining into the central vein, and then into the hepatic vein, and then into the inferior vena cava. The portal lobule is triangular in cross section and contains the three adjoining hepatic lobule and has a central vein periphery at its three corners. So at its three corners, the three central veins are present. And it is this interpretation of the lower structure is based on its exocrine function, that is the production of the bile. Then hepatic acinus. You can see hepatic acinus. There are two central veins are present and two portal triads are present on the periphery. So this is the diamond-shaped structure. Hepatic artery is present on the corners, or you can say on the portal triads. So this hepatic artery gives the branches. And then this area, which is close to the center, you can see this area is richly supplied by the blood. So oxygen is present over here. More oxygenated area is this area, which is the peripheral area. This one is the classical lobule. You can see we discussed it that this hexagonal structure is the classical lobule. And now this is the hepatic acinus. For our convenience, we are, as a scientist, we are dividing it into the different lobes and lobules, okay? You can see these are all the classical lobule hexagonal in structure, which are attached one by side by side. The walls, they are also sharing the same. And then you can see in the center, this one is the acinus. Okay, 1, 2, 3. The middle, you can say middle mein hai, then this one is the peripheral area, then middle one, and this is towards the central vein and central areas. Okay. क्यों इम्पोर्टेंट है, इसकी क्या इम्पोर्टेंस है? बिकॉज कि ये जो एरिया नंबर 1 है, इज रिचली सप्लाइड. तो यहाँ ये एरिया जो है, यहाँ पे आपका डैमेज टू द लिवर और इन्फ्लेमेशन के चांसेस लेस होते हैं. देन मिडिल एरिया जो है मिड में है, और थर्ड एरिया जो इट हैज chances to be more inflamed easily. Why? Because of the lack of the oxygen. As the oxygen oozes out or coming out from the hepatic artery is supplying. So first of all, the area 1, then 2, and then 3. Okay. Now come to the main thing, which is the hepatocytes. Hepatocyte means the cells of the liver. Okay, you can see now pyari diagram. And this one is the hepatocyte, yellow in color. Okay, this is you can say polygonal in shapes. Okay, in between the two hepatocytes, a small ductule is also coming out. This is the canal of the hearing, and then they are all joining with the different canals, and then you can see they are draining into the duct, and this one is known as the branch of the bile canaliculi, and this bile canaliculi they enter into the bile duct. Okay, so here the septa is also, you can see this is the interlobular septum, okay, which is just dividing the whole classical lobules or so. You can see this one is white in color. It's a connective tissue septas. This connective tissue septa, they have the blood vessels, the artery, the veins, and the ducts, okay, running into it. And this is the best diagram. You can see the central vein. It has many pores. And this is the sinusoids. And they are all draining the blood into the central vein. In between the sinusoids, you can see the hepatocytes. And this hepatocyte, you can see the nuclei of the hepatocyte and cytoplasm of the hepatocyte. And they are lying, you can say they have sharing the adjacent walls. In the adjacent wall, this one is the canal of the hearing. Small canals are present. And these canals are just coming out in between the two hepatocytes, joining together to form the bile canaliculi. And this bile canaliculi, they are all entering into the bile duct, and the bile ducts are all gathered together to form the large bile duct or the common bile duct. Hepatocytes under the electron microscope, here you can see that they have to perform the metabolisms. So they have many mitochondria. Golgi apparatus also present, and the rough and smooth endoplasmic are present, and the lysosomes are also abundant for the, you know, the functions of it all. I think so. Just recall it. The mitochondria is supplying the energy for the cellular function. Golgi apparatus just packing the different enzymes and all the structures. Lysosomes are for the killing purpose or lytic functions. And so, if any microorganism, germs, bacteria, viruses entering through the villi into the blood and then reaching to the liver, they are all cut down through this lysosomal activity. Here, this is a very good diagram. You can see, you can understand it or not. These are all the hepatocytes. You can see small canaliculi are coming out in between the hepatocytes, and they are forming the canal, this canal of hearing. They are all joining together to form this small bile ducts, and then this one bile canaliculi, and they are all draining into the bile duct. The bile ducts are also entering into the common bile ducts. Okay. The second thing is that in between the hepatocyte, you can see the spaces. These spaces are known as the sinusoids. Okay, and you can see here this is the spaces in which the blood is present. And in between the sinusoids and the hepatocyte, you can see small space are also present, and we can see the perisinusoidal space. Peri means around the sinusoid. This perisinusoidal space is known as the space of the Disci. Okay, here the ito cells are present, macrophages are present. Okay, we can see. Okay, you have to go through it and you can just read it. Okay, I think you have to understand all this. Okay, the blood is coming from this vein, entering and draining into the central part, the arteries or hepatic artery. You can say red blood. They are also entering, and they are also just pooling into the sinusoidal spaces. Here, the mixing of the two bloods occur in the sinusoids, and then finally, they are ultimately get all draining. Okay, the picture is very good, and you have to understand it all. You can see this one is the small septas are present. There are the rows of the hepatocytes are present, and here this is the space which is known as the sinusoidal space. So in between the hepatocyte and the sinusoid, the space is known as the space of the Disci, and it has the specific cells which are present only here, known as the I2 cells. Okay, here you can see these are the rows of the hepatocytes, and between the rows of the hepatocyte, this is the sinusoid. Pooling of the blood or spaces for the blood, and in between this sinusoids and you can see the hepatocyte. Here, this is the space of the Disci present. Here, the Kupffer cells are also visible over here. These Kupffer cells are related with the macrophaging or phagocytizing action. This is the normal liver anatomy. You can see the hepatocytes are present. This is the space of Disci where the macrophages are present and ito cells are also present. And this is the Kupffer cells. They are Kupffer from where it comes. The Kupffer cells are coming from the blood. They are present over here. So they are the basically macrophages, and whenever it you can say there is some injury here, you can see there is some injury occur. So what happens that, okay, the Kupffer cells, they are also active. They becomes activated one, and then they are the mobile one. They can come into the sinusoidal space. They also present into the space of the DC, and they can migrating easily. Hepatobiliary system जब हम बात करते हैं, the ductal system of the liver, you should know about it, how they are working. ठीक है, यहाँ पे देखिए ductal system which is showing into the green in color. This is all the hepatocytes, the 2-layered thick cells. So in between the 2 layers, this small ducts are present and taking the bile from each and every hepatocyte, and then through this canalically and finally draining into this duct. Okay, and this is covered with the cuboidal cells also. Okay, the duct system begins in the form of the bile canaliculi wall, of which are formed by the plasma membrane of the adjacent liver cells. The bile canaliculi are connected to the interlobular bile duct by means of the short narrow canals called the bile ductules or canal of the Hering canals. Okay, so here you can see the canal of Hering. I'm saying that again in between the adjacent hepatocyte, the small canals are present, known as the canal of Hering. And they are just joining this small canaliculi, which is known as bile canaliculi, and this bile canaliculi joined with the bile ductules and then bile ducts. Okay, so you can understand this all. This is very good. You can see the 2 hepatocytes. This is a tight junction, and here this is the canal of Hering. This is the endothelial cells, sinusoids space or sinuses, where the blood is passing. Kupffer cells are also present over here, plasma cells, and then here these are another layer of the hepatocyte or the liver cells. So in between the 2 liver hepatocytes, this is the sinusoidal space, and basically they are the 2 layer. Here you can see that they are the 2 layers of the hepatocyte. One is facing this sinusoid, the other is facing this sinusoid. In between the 2 layers, the small ductule is the bile canaliculi. Okay. Okay, hepatic sinusoids जो है, they form an extensive. और where is the hepatic sinusoid? The blue in color जो ये है, they are all the spaces. Okay, ये branching जो है सारी की सारी, they are all the hepatic sinusoid. The blood sinusoids form an extensive sponge work between the plates of the hepatic cell, and these sinusoids have an incomplete basal lamina and are lined by the 2 types of the cell. One is the endothelial cell, and the second one is the Kupffer cells. Endothelial cells showing fenestrate or the opening, small pores. Here you can see this one is the endothelium. It has a small pores for the you can say the passage of the different molecules. Okay, and here you can see this is the Kupffer cells. Okay, and which are not closed by the diaphragm intercellular gaps, are also present between the adjacent endothelial cells. Kupffer cells, which are found on the luminal surface of the endothelial cells, and main function of the Kupffer cell is the macrophaging, and so they are phagocytizing if they have found any foreign particle or foreign bodies. The stroma of the liver, stroma means the connective tissues. First of all, we say that it is also covered with the glycan capsule, and this glycan capsule, they are connective tissues, and they are not working in the metabolism and in the absorption and in the formation of the bile, and they are not you can say they are not functional in the sense that they are not doing the function like the liver. But the connective tissues are very important. Why? Because they are covering the whole, giving a protection over the whole surfaces. Secondly, they are also giving the small septa inside it. Here you can see the connective tissue septas are present. So these septas are coming from this glycan capsule toward the internally and toward the centers. Okay, and these connective tissues, they are carrying the blood vessels, the nerves, and the lymphatics along with it. So the liver is covered by the delicate connective tissue capsule, which is known as the glycan capsule. At the porta hepatis, the capsular connective tissue becomes continuous with the connective tissue of the portal canal. In this way, the entire organ is permeated by the connective tissue skeleton composed of the collagenous fibers and fibroblasts. Within each hepatic lobule, a meshwork of the reticular and the fine collagenous fibers is present around the blood sinusoid. Blood supply of the liver. How the blood supply of the liver is that you see that it is a dual supply. One is from the hepatic artery. This is red in color, give a oxygenated blood. The second one is the Hepatic portal vein. Okay, here this is the hepatic portal vein. It's also give branches. The blood is putting into the sinusoid. We have seen, and the 80% of the blood is comes through this portal vein, and 20% by this hepatic artery. So they are all entering through the porta hepatis and supplying to each and every lobule of the liver. Okay, and the efferent ones are coming from the central veins. They are all coming to form the hepatic veins, and this hepatic veins, they are all you can say these are all the tributaries of the hepatic veins, and they are all joining to form the hepatic vein, and this hepatic vein directly enters into the connecting the with the inferior vena cava and pulling its blood to the inferior vena cava. Okay, so these are all the branches. You can just go through it. Just I think so. Okay, you should remember that the two dual supply here, but ultimately supply to double layer, again draining single layer. Okay, lymphatic drainage of the liver. No lymphatic capillaries are found in the hepatic lobule itself. However, the lymph is formed from the fluid in the space of the disease, from where it passes into the lymphatic vessels, which originate mainly in the binding the connective tissue of the portal canals, and this lymphatic vessel communicate with the lymphatic vessels of the capsule, and ultimately large lymphatic vessel leave the liver through the porta hepatis. So here you can see there is no a large network of the lymphatic channels, but at the level where where you can see at the level of the space of the disease, here you can see this at the level of the space of the disease, here you can see the perisinusoidal space. What happens? Some escaping of the blood occur, and these are all draining into the lymphatic channels, and which is finally drained into the liver. Okay, Achha, now this is the, I think we have done the macroscopic structure as well as the microscopic structure of the liver, and now we are coming toward our first slide, and that was the blood supply of the and the venous drainage of the hepatobiliary system. Okay, common hepatic artery. Okay, common hepatic artery, from where it comes, this is the celiac trunk. It gives a common hepatic artery, and this common hepatic artery, you can say it runs upward and divided into the right side and the left side, right hepatic artery and the left hepatic artery, and the blood is directly coming from the abdominal aorta, and then they are supplying this. Okay, branches of the common hepatic artery, here you can see this is the celiac trunk, gives the common hepatic artery, and this common hepatic artery gives many branches. Okay, one is the gastroduodenal artery. Gastroduodenal artery, this is the gastroduodenal artery. They are supplying not only the gastric or the stomach, but also the duodenum. Okay, and further gives many branches. The right gastroepiphytic artery, this one is the right gastroepiphytic artery, and the superior pancreatoduodenal artery. This one is the superior pancreatoduodenal arteries. Then this one is the right gastric artery. Here you can see the right gastric artery is also the branch of the hepatic artery. Okay, this one is also the branch of the artery, and the supraduodenal arteries are also present, which is passing toward the you can say, okay, on the superior part of it. Here you can see this is the celiac trunk coming from the abdominal aorta, and then gives the hepatic artery. This hepatic artery, that gives the two branches. One is the anterior, the other one is the posterior pancreatoduodenal arteries. Okay, here you can see, and they are in anastomosing with the pancreatoduodenal artery, inferior pancreatoduodenal artery, which are the branches of the superior mesenteric artery. Okay, and then you can see the suprarenal artery is also the inconstant branch, sometimes visible, sometimes not, supplying the first part of the duodenum. So it is also coming from the hepatic artery and supplying to the first part of the duodenum, so known as the duodenal artery. Then you can see this is again, this is the main hepatic artery. Posteriorly, portal vein is visible. Okay, this is a hepatic artery, right and the left side. This right one is giving another branch known as cystic artery, and this cystic artery we are supplying to the gallbladder. Okay, and this right hepatic artery goes up and then give branches and entering into the right lobe of the liver, while the hepatic artery gives the left main common hepatic artery gives another branch known as the left hepatic artery supplying the left lobe of the liver. Okay. This area where this hepatic artery and portal vein enter known as the porta hepatis. Okay. And in portal veins, the main thing is that how the portal vein is formed. Portal vein is formed by this splenic vein and the superior mesenteric vein. Inferior mesenteric vein is the tributary of it, either directly open into the superior mesenteric vein, sometime at the commencement of the two veins here, or sometimes the inferior mesenteric vein enters into the splenic vein. So the portal vein is carrying all the blood coming from the small intestine and through the inferior mesenteric vein to the large intestine, and also from the splenic vein to from the spleen. So this blood is carrying the lymphocyte through the splenic vein, contains the carbohydrates, or you can say the glucose, the amino acid, the fatty acids, which are all absorbed into the intestine, and then they are the highly nutritious blood is entering into the liver for metabolisms. Here, this is the point where the portal vein are formed, and it is at the level of the second lumbar vertebra, just behind the head or neck of the pancreas. Okay. Now, this is the splenic vein. This one is the superior mesenteric vein. They are just joining over here, and then they are. This is the total portal vein. Okay, this is the length of the total portal vein, and it's about the 8 centimeter long from here till here. And then they are just portal vein, hepatic portal vein. They are entering into the liver. Acha, collect the blood from the abdominal part of the gastrointestinal tract, gallbladder, pancreas, and the spleen. Convey blood to the liver, sinusoids, liver sinusoids draining finally into the hepatic vein and then into the inferior vena cava. Okay. Here, this is the total portal vein coming either from, this is the superior mesenteric, this is the splenic, this is the inferior mesenteric vein, and also some gastric veins are also draining over here, and these are all the tributaries coming from the colon and colic veins, and now they are just draining into the, so total portal vein is 8 centimeter long. Okay. Parts of the portal vein, here you can see we are removing the pancreas to see the retroduodenal part, or this is the duodenum, so this is the retroduodenal part, and this is the supraduodenal and infraduodenal part. So we are dividing into the infraduodenal part. It means that just below the anteriorly is the neck of the pancreas. This is the pancreas, so it is the neck of the pancreas, and this is the infraduodenum. Duodenum is present over here, so it is the infraduodenal part. Retroduodenal means the posterior to the duodenum, and then supraduodenal part, which is the superior to it. Here you can see, I think so. Okay, it's so easy. This is the stomach. This is the duodenum. So just behind this duodenum, the part of the portal vein is known as the retroduodenal. This part is known as supraduodenal, and this part is known as the infraduodenal. Okay, and here this is the superior mesenteric vein. Okay, these are all the parts of the portal veins. Portal vein divides into finally into the right and the left branches. Right branch is the cystic vein, and the left branch you have, this is the receiving the perambilical veins and the ligamentum teres and venosums. Okay. Intrahepatic vascular and the ductal system. These are all the tributaries. The splenic veins are superior here. The splenic vein, superior mesenteric vein, right and the left gastric veins also present over here from the stomach. They are coming. Okay. Here you can see the right and the left gastric veins. Okay. And superior pancreaticoduodenal veins and the perambilical veins and the cystic vein from the right side. So these are all the tributaries. It's also important, the tributaries of the portal vein, how the portal vein is formed, and what are the tributaries of it, and what is ultimate goal. Okay, we have done it. Okay, all the macroscopic structure as well as the microscopic structures. Okay, first of all we done this gross anatomy, then the histology, and then finally the blood supply of it, and also this is H&E staining. Okay, hematoxylin and eosin staining, and so it is written as a lower H&E. Okay, the sheets of the hepatocytes and so on. I hope so that kids all recall you. Regarding the histology, you should know the classical liver lobule, the portal lobule, and the acinus. Okay, because each you have to focus on these all. So this is a classical lobule connecting all 6 lines, and here you can see portal triads are present on each corners. Okay, and when we discuss the portal is the connecting the 3 central areas, and here the acinus is regarding with the formation of the bile and draining it into the bile duct. So they are all coming from the hepatocyte toward the bile duct, toward the portal. So from the center to the periphery. Otherwise, when regarding to the blood supply, this is from the periphery to the center. Okay, students, I think so, hope so. You have to go through these all areas and everything. And regarding pathology, hepatic acinus is very important because this is the area which is richly supplied, centrally richly supplied with the blood, oxygen to blood, then less oxygen, then toward the central vein. This area, they can easily become hypoxic or ischemic, and due to the less oxygen supply, they can be necrosed or inflamed or have any pathological problems. So more prone to it near the central vein area, or the surrounding the central vein. Okay, students, hepatocytes we have done. A space of disease also important regarding the MCQs. This is the perisinusoidal space. Here the hepatocytes layers are present. You can see this is the 2 layer of hepatocyte. In between the 2, this is the pooling of the blood into the sinusoid, and perisinusoidal space, this one is known as the space of the disease. Ductal system, we have done it. How there's a small canal of hearing joined together to bile canaliculi. This bile canaliculi joined together and form a duct into the duct, which is known as the a small bile duct, or the interlobular ducts and so on. Okay, endothelial cells and Kupffer cells, you should know about it. Stroma of the liver hai, which is the capsule, basically blood supply, we have done it. Lymphatic drainage of the liver. Okay, students, now lecture is completed, and if you want to ask anything, you can write your answer in chat and I will see. Okay, yes, if you have, you want to. Okay.
Assalamualaikum, ma'am.
हाँ, ओके फाइन. कोई क्वेश्चन तो नहीं दिया है स्टूडेंट्स ने. आई थिंक सो कि मैं कंप्लीट कर दिया. ओके,
ठीक है मैम, थैंक यू सो मच. थैंक यू.
ओके, थैंक यू सो मच.